So this first video, I'm going to be showing the FABBER test, the grind scour test, and the Piriformis testing. So with all these tests, the patient's going to be in supine, and the big thing I'm looking for is any kind of symptom reproduction that they would be complaining of. So for the FABBER test, I would put the patient's hip in question into flexion, abduction, and external rotation. And then I would try to get him to rest it just on his lateral malleolus on his knee. And then I press down on the inner part of the knee and the ASIS of the opposite knee, of the opposite hip, and I just push in, checking for any symptom reproduction. Anything?
My left back, my lower back.
Lower back? Okay. So for the grind scour test, this would be good for testing for any osteoarthritis. So I'm going to put the patient's hip into flexion, adduction, and any internal rotation, checking for any symptom reproduction. And it looks like there is some symptom reproduction. That hurt?
That's okay.
And that's the grind scour. And then the Piriformis, keeping the patient in 90-90. I'll provide an external rotation to the hip, and you should be feeling some stretch about right along there. Any pain with that? And those are the FABBER tests, the grind scour test, and the Piriformis test.